Hi, I'm Jean McConnell of Pinnacle Health Concepts Physical Therapy, and I wanted to discuss with you today briefly a little bit about your neck, how to take care of it, what the anatomy consists of, some basic exercises so that you will know how to care for your neck properly. Your neck consists of 7 cervical vertebrae. The first one is right behind your ear. If your ear hole is right here, then this is the first cervical vertebra. Now let's take a closer view and an easier view of these bones of the neck so that you can understand what I'm talking about. These 7 bones are separated by discs, and the disc is a very viscous, compliant piece of material, soft tissue, mostly water. It's made up of water, and 2% of it is protein. It keeps the bones from hitting each other. On the side, you can see this red thing. This is an artery called the vertebral artery, and it feeds the bottom part of your brain. It goes up the sides of the cervical vertebra. It has to make a 90-degree angle when it gets to the top vertebra, and then another 90-degree angle to get into the hole of your brain called the foramen magnum. And that's what feeds the bottom part of your brain. The skull, inside the skull is your brain, and that brain turns into the spinal cord. Off of the spinal cord are these little tributaries called nerve rootlets, and each nerve rootlet feeds a specific part of your body, and they are run on electricity. If anything interrupts that electricity, you're going to have pain wherever that nerve root travels to and what it feeds. What holds the bones together are ligaments. Ligaments attach bone to bone so that it doesn't fall apart. And over top of that, the ligament structure are small, tiny muscles. We call those the paraspinals. They each have specific names, but we won't go into that right now. And over top of these small muscles are bigger muscles that we're more familiar with, that you can see, especially with somebody who works out a lot. You can see their musculature. That makes up the bulk of the cervical spine. If you take good care of your neck, you're going to have nice range of motion that is smooth and equal. You'll have good flexion. You'll be able to look up from side to side and from left to right without any problem. It'll be equal on either side, and it will not make a lot of noise. For some basic, easy to do exercises, I call these red light exercises because you can do them every time you hit a red light. Hold your head still, and the first red light, maybe what you want to do is just try to push your head and you resist that. That's called an isometric hold. You hold that for 5 or 6 seconds and then you repeat on the other side. You could do it forward, try to look down and resist yourself looking down. And then you can put your hand back here and resist yourself looking upward. You can twist, try to turn your head, and then turn your head to the other direction. Those are easy exercises. They take no time at all to do, and they keep your neck muscles healthy and happy. Now there's good and bad ways to do everything, and there's good and bad ways to sit. I want to discuss with you how to sit properly. You want your ears to be over top of your shoulders. You want your shoulders to be over top of your hips. Sometimes that's hard to get, and an easy way to do that is to take a towel, roll it up, and put it in your mid-back, not your low back, but your mid-back, so that raises your shoulders and your chest so that you don't have to worry about being in an alignment. It will already be there. You want your hips to be at a 90-degree angle so that you're sitting comfortably. You want your knees to be bent at 90 degrees and your feet to be rested flatly on the floor. Your arms should be well supported, so try to always find a chair that has some type of an arm support to it. That way you'll be more apt to sit properly for a longer period of time. It doesn't really matter what type of chair that you have. You can have a variety of chairs. A rocking chair will suffice. It has a good base to it, a high back on it. You could use your towel roll in your mid-back to help lean back over top of that so that your spine is supported. It has the armrests so that you could rest your arms, and everything that happens in a regular chair could happen in a rocking chair or any chair that you choose. When you lie down to sleep at night or lying down to rest, there's certain things you want to think about. To support your neck, of course, you may want to have a pillow, but rather than having two pillows, take a towel, roll it up. You could stick this underneath your pillowcase or right under your neck so that your neck is adequately supported. You also want to consider having your whole body comfortable. Placing a pillow underneath of your knees takes pressure off of the low back so that you can rest comfortably in lying. When you lie on your side, you want to be comfortable so that you can stay there. You want to have your pillow, plus this towel roll is very nice for your neck. You roll it up, you place it under your neck so that your neck stays straight. In order to support your rib cage and your shoulder, you want a pillow over here to support your up arm. You want your hips and your legs to be stable, and the way that you maintain that is to put a pillow that will support your knee as well as your ankle. A lot of people just do their knee, and that doesn't necessarily help. You want to be able to get both the ankle and the knee supported with a long, thick pillow. Lying on your side, you will be able to maintain your comfort if you are properly supported. Your neck, your shoulder, your hip, your knee, and your ankle all supported. It will allow you to lie for a long time in complete comfort. Taking care of your neck is pretty easy. The basic principles that we reviewed here today are easy to follow. You sit with the postures that we described, you sleep with the postures that we went over. I think you'll find yourself feeling a lot better. The exercises are easy. You can do them anywhere. So just try to have a nice time taking care of yourself and you will feel a lot better. It's easy and it's healthy for your neck.